All right, here we go, 11 o'clock. Welcome to the first of 3 hour-long panel discussions of the domino effect of quarantine and responses to COVID-19, which I'll be calling the virus because I'm American and I like to shorten things the most effective and dramatic way possible. This is a collaboration between the Building Performance Podcast and Healthy Indoors Magazine. This will be part 1, how this pandemic is affecting us. Part 2 is going to be from 1 to 2 p.m. Eastern, and that's managing the public health crisis. And part 3 from 3 to 4 p.m. is going to be practical antivirus measures for buildings. All of this is obviously, since it's coming from us, it's going to be centered around the idea of the fact that we're all kind of indoors and how this is affecting life right now. We already spent 90% of our lives inside, and now it's jacked up to a higher level, especially in homes. So please put any questions or comments you have in the Q&A box that is in your Zoom navigation pane there. Don't use the chat box, that's just for technical stuff. We have an awesome group of experts participating this hour, so let me introduce them before we dive in. First, we have Dr. Michelle Sanborn, a board-certified internal medicine physician who holds a master's degree in public health. She's worked with the U.S. Air Force and Army, and as a hospitalist for civilians, and she's also the doctor I lean on first when my kids have medical emergencies, like I drop them on their heads, because I'm lucky to be her cousin. Michelle, thank you very much for being here.
Hi.
Next, we have healthy building scientist Joe Medosh of Hayward Score. To say Joe has a diverse experience base and interests is a tragic understatement, as you probably have picked up on this little pre-roll. But suffice to say, he's been pushing the envelope with the science of homes for the past 18 years and is a fountain of fresh ideas. He's also a good friend of mine. Joe, thanks very much for being here.
Oh, that'd be me.
That
if
is
you didn't
correct.
know, right? Yeah.
Most of what I know now about chemistry, I learned from our next guest. Dr. Delphine Farmer is an environmental chemist who researches both outdoor and indoor atmospheric chemistry and gives incredible explanations of what she discovers as well, which is not normal for scientists. In 2018, she co-led the House Observations of Microbial and Environmental Chemistry Experiment, or HomeChem for short, which is where I was fortunate to first work with her. Delphine, thank you for being here.
Thanks for having me.
And last, we have Bob Krell, the esteemed publisher of 2 magazines central to the scientific home improvement and construction industry, Healthy Indoors Magazine and the Building Performance Journal. For the past 30 years, Bob has been investigating and mitigating indoor environmental issues in residential, commercial, educational, and healthcare facilities throughout the US. And as you might have guessed, he's also one of my favorite people. Bob, welcome.
Thank you.
And thank you for hosting this. Yes, thank you for doing all the technical backend.
I was going to say one housekeeping thing for the viewers out there. You have in the upper right-hand corner of your screen, you have the choice to toggle between speaker view and gallery view. And the speaker view will give you the current speaker at full screen, and gallery view will let you see all of us as the Brady Bunch. So that's an option you have at home. So just wanted to point that out to people.
Excellent,
Sorry.
thank you. So if you don't know me, I'm the amateur in this group. I'm Corbett Lunsford. I'll be moderating this first part of the series. My 12-year background in testing the invisible dynamics of physics, chemistry, and microbiology in homes is how I got interested in this. I also co-host Home Diagnosis, which is the first television series about the science of homes, which airs on PBS. So to set the stage for this hour's conversation, we'll focus on the logistics of what's happening right now worldwide, the game theory of it, if you will. We are now spending almost 100% of our time in our homes. Don't forget to take walks, everybody. We did a couple yesterday. We're the only people on the street. If we were guinea pigs of indoor chemistry before this, how much more so now that we're all locked in? So how many people that you can think of have truly safe homes where there are none of the health risks that many of the building professionals listening in see and test for every day? I can picture lots of unhealthy homes that I'm having nightmares about people being trapped in all day long. So the 3 high-level things that we can do to keep our homes healthy, where we're trapped right now, which we'll dive into in detail in part 3, are number 1, don't bring bad stuff home. And that includes the virus. Number 2, keep it dry. And number 3, ventilate. And again, we're going to be much more specific about that in part 3, which is 3 p.m. Eastern today. So to start us off with context, Dr. Sanborn, can you please tell us, have we ever quarantined everyone at the same time before?
Not like this. There was a big epidemic, a pandemic in 1918, of course, for influenza. And of course, we saw the polio virus that hit about 30% of the population. But I don't think we've done it this way before.
Very interesting. Okay, so Joe, the homes that we're closing ourselves inside differ regionally, obviously, and by climate. But what is a reasonable list of general side effects that we might expect with everybody spending all day, every day inside a modern home this spring?
The answer to that is that you can't say those kind of statements because I could put us all in the same nasty contaminated house and we all have different symptoms. The issue is how many symptoms you might be having, but the real question now is that will you have more symptoms or will your symptoms become more severe? So those are the issues, but we now know that the home will no longer kind of settle because we keep messing with the home now. We're home more often. Carbon dioxide will go up, particulates go up, chemical use is going to go up. So all these things will increase our burden that our house usually we had relief from. We no longer have that kind of relief because we're in it too long. So this is truly the greatest experiment on humankind ever. And I just wish that we had more. We actually have some of the best data out there in the individuals. We just need to figure out how to get that back from people that are now going to experience a new reality in their home. So that's one of our goals, is how to reach out and get that information back from individuals.
Very interesting. So Delphine, I would love to jump into your research that you just published. So there is, Dr. Sanborn provided us with a 9-page list of EPA compliant virus fighting products, 9 pages, single spaced. So what side effects are these disinfectants that everybody's crazy about right now and hand sanitizer having on our bodies and on the air that we breathe in our homes?
Yeah, so this is a huge question. There are a lot of different ways to disinfect and sanitize, and I think there's some pieces of chemistry that everybody needs to know right now. And I think the first one is, I think my first message is going to be always you want to minimize the chemistry that you're being exposed to that's toxic, while also balancing that with our need to try and keep this coronavirus outside of our homes and preventing transmission. So what that really means is some of the old-fashioned techniques like soap and water. They do beautiful chemistry and it's not harmful to humans, but it's very harmful to the viruses, right? Soap acts to disrupt membranes of the virus, break them apart, and it can be very, very effective. There are some other really popular tools. A lot of these ones that are in these lists that the EPA has provided, and a lot of other disinfection products that are popular. A lot of them are also very, very effective, but they can also be quite toxic. Bleach is the big one. We've been studying that in my lab for a while now. And so bleach does some really dangerous chemistry, very effective at killing viruses and bacteria and lots of other microbes, but it also, those same toxicities can impact you. And so I think my biggest message is that, well, bleach is really effective. It does chemistry and it reacts with your skin. It will react with the lining of your lungs. It will also react with other molecules that you have put down. So if you cleaned your house with something like pine sol or soap and water, great. But if you immediately go and clean with bleach solution, then you're going to kickstart a whole series of chemical reactions that are going to produce some potentially really toxic products. And that can be a real problem. We also have products like peroxide, alcohol, ammonia. All of those can disinfect in their own ways. The real problem is that they can react with each other. And that can produce a whole series of potentially really toxic products. The worst one is ammonia and bleach. And whatever you do, you have to keep those separated. But it's important to realize that if you clean your bathroom with ammonia and then you come back an hour later and you clean it with bleach because you're worried, that chemistry can still happen. And so I think it's a really important message that we can all get out is to, yes, disinfect, yes, clean, but don't allow different chemicals to mix because the potential for toxicity is really there. And I think we're all on board with trying to minimize people going to the hospital for any reason. And so this is one thing that everyone can do is to be really careful of your cleaners.
And I think you pointed out in the home chem experiment and in our later interviews that are hopefully be in season 2 of Home Diagnosis, which is on schedule, I'm hoping, that ventilation, like it says on the instruction manual, on the side of the bottle of bleach, how to apply this, right? And so can you talk a little bit about how that might have a side effect as well?
Absolutely. I mean, there are 2 aspects. One is, mixing chemicals to manufacture instructions. They're there for a reason. And number 2 is all of those chemicals, they all say apply and ventilate your room. So turning on fans, opening windows. We have a ton of experts on this panel who know far more about ventilation than I do. But what I do as a chemist really understand is that you have to dilute any of these compounds, and that means clearing out the air as rapidly as possible. So when you clean, open up your windows, one of the side benefits of all the reduced traffic from fewer commuters and less industry is that our air quality outside is going to be better. And so open those windows, and there's so many reasons that that's good, but to get rid of to minimize your exposure to the toxic products from cleaners and disinfectants and any potential side products, that's really important. And I'll say that some of these side products, there's nothing you can do about it. We breathe out ammonia. When you cook, there are amino acids that are in the chicken or the beef or the food that you're cooking, and those are going to react with the bleach, and they will make some toxic products. So even if you're not mixing your chemicals, ventilating the house is one of the best things you can do to keep you and your family healthy.
And of course, it's pollen season, so opening your windows has a whole other side effect now of respiratory distress. By the way, so I'd like to have Joe and Bob and also Michelle tune in on or chime in on this next thing, which is that the other thing, aside from ventilate, is vacate, right? You're not supposed to be around the bleach while it's doing its little chemistry thing, right? So when we go to these necessary places, grocery stores, hospitals, wherever else, at the post office, I don't even know if the post office is still open, but they are cleaning with bleach probably, or something that's doing, so what's happening to us when we go into these places that have to stay open, that we need to be able to get our toilet paper from when they are cleaning with these disinfectants?
Well, I mean, one of the things I'd jump in, to reinforce what Delphine said, in my 30 years, I can tell you numerous occasions I've seen interactions with ammonia and bleach, unintentional, of course, but in cafeteria situations, in schools where they're using a quaternary ammonia sanitizer in the dishwashing system, and the room monitors are going out and using a bleach solution on the dining tables out in the dining area, and then coming back and dumping the bucket into a common grease trap. That one example. Healthcare facilities. Ton of my clients are using this process where they're going in and using a quaternary ammonia cleaner, and then coming in with a bleach, a secondary, they're trying to use a 2-part clean and kill. Is that common, Michelle? Because I've seen it in the Northeast, and that it doesn't seem to be as problematic in just patient areas where they're taking an interval between, but where there's high turnover rates like the ER, where they're doing fast room turnovers. Big problems, because they're coming in, housekeeping is coming in when the other product's still there and active. So I can't stress that enough. The chemicals, we didn't have a great environment indoors to begin with before we started this, and it hasn't improved with this situation. Actually putting ourselves in there, spending more occupancy, doing more activities over 24/7 now. It's definitely a concern.
Yeah, there's a real temptation to say, if a little bit of cleaner is a good thing, then a lot of a cleaner has to be even better, right? And we've got, I know people are sitting there. I have a family member who's sitting there with alcohol and peroxide and bleach, and was saying, well, I'm just going to use all 3. And I was like, no, because all of that generates really dangerous chemistry, especially if you mix them together. But even if you layer them, and the layering, 1 round, as you say in the hospitals, 1 round of one cleaner, even if you wait a half hour, an hour, another cleaner coming on top, you still get that chemistry.
There's still residual, yeah.
Yeah, I think you're really better off trying to think about one type of cleaner for a given surface and just sticking to that plan.
We have a follow-up audience question that jumps into this. The question is, doesn't the alcohol in hand sanitizer carry fragrance chemicals, et cetera, into the bloodstream? Anybody want to jump on that one?
Well, let me just jump in as an amateur, as the dum-dum on this, because I think that the idea that hand sanitizer is just sanitizer is silly when you can smell it. So what people are doing, the reason they keep saying wash your hands is better than sanitize your hands, is because you have dead bugs on your hands now, and you have chemicals. And now you're going to go eat a sandwich, and you just are putting all these chemicals and the dead bugs on your hands in your mouth. Which is pretty gross. So again, like washing your hands, much better than hand sanitizing. I don't even use hand sanitizer in general. Delphine, do you have anything to add, or Michelle?
Yeah, I mean, I think there's always a balance of potential negative effects. And so if you're, I would in no way, when I go to the grocery store and I come out before I get into my car, I am using hand sanitizer. I have someone with a vulnerable, who's in the vulnerable populations at home. And so to me, that balance is worth it. But soap and water is in many ways an incredibly effective tool, and probably more effective than using hand sanitizer, and fewer side problems. So I think that's pretty clear. I mean, all of these chemicals, I mean, everything that we are using is certainly your exposure, both through breathing it and eating it, is going to introduce those into your system. And I think it's a personal choice as to how much you're willing to do that at this point in time. And I think I'll leave it to Dr. Sanborn to chime in on that.
I would mention that for this virus, we recommend over 60% alcohol based hand sanitizers, but keep in mind that alcohol can be absorbed through the skin into your bloodstream. So if we did a test to see if you've had alcohol, we would find it in your bloodstream. And also bear in mind that kids, hand sanitizer is great for kids because it's quick and easy, but they can lick their hands and then they're exposed to alcohol. So just keep it in the back of your mind, risks and benefit balance.
So in that chat, I put two nice links, one of which is a New York Times article showing why soap is more effective than any hand sanitizer that you could have, and it shows molecularly how it actually breaks down and disrupts viruses, which is in a way I didn't know. I did my homework last night because I didn't want to show up here and just talk about stuff that I didn't know about. So I tried to do that, as well as I gave a link to Environmental Working Group, which actually evaluates these types of green cleaners, and they have their own lab that they send stuff out. So the link there also gives you recommendations to green or better cleaners, or if a hand sanitizer met their approval, or they also disclose chemicals that the manufacturer may not.
Yeah. And one thing to add into there is that one of the beauties of soap is a virus is like a little droplet of grease. It's a little more complicated than that, but you can disrupt the membranes and break apart that using just simple soap. I noticed it on the Q&A, someone's asked about Windex, and I think that's a really interesting one. So some forms of Windex have ammonia in them, but my understanding is they don't meet the established criteria for killing off the microbes and viruses. And so they're great. They're potentially good for cleaning your windows. They're not, I wouldn't think of them as a disinfection. I think you have to use, I think there you want to go and look at some of these EPA, FDA, WHO recommended cleaners. And again, soapy water is great. Dilute made to manufacturer instructions, bleach or peroxide or alcohol. But as Dr. Sanborn says, you've got to be, your alcohol has to be over 60% if you actually want to be effective.
A note to audience, those of you who are asking questions, there is a tab that says answered questions. So if you're looking for the links or other answers, you got to click on answered to see the results.
Great. While we're on the topic of chemistry, just for a second, I just went on Amazon 5 minutes before we started this, and right now you can search ozone generator and find 350 products with thousands of positive reviews that claim to sterilize your home. I would like to open this up to everyone. Why would this be completely insane for anyone to do in their home?
Oh no, zone.
It is so toxic. It's a key component of air pollution. Ozone, it reacts with your skin surfaces, it reacts with the lining of your lungs. Exposing you and other people to extra ozone is that's a whole different set of medical problems and long-term health problems you are exposing yourself to. It's from a health perspective, the science is incredibly well established that ozone is really toxic. And so I cannot discourage anyone enough from using ozone in their homes, particularly if anyone is living there.
The challenge is that many of these home purifiers or portable units have electronic static cleaning parts of them that actually are trying to, put in one positive charge and then collect it as a negative charge, which can create a small amount of ozone, which in the industry is considered to be an acceptable amount of ozone and not hazardous, which we don't believe in at all. Any ozone is bad ozone. So, and they're included in most of the units. So our advice is get one and understand how to turn it off immediately so that you're just getting the filtration or the carbon filter if you have that. That's the most effective part of what these things do. They grab stuff and you throw them away. So I would not be aware of how your unit works and how to turn that system off.
And to be clear, Joe's talking about get a filter. If you need an air purifier or a filtration, just get something that has a fan and a filter on it. And that's all the electronics that you need. By the way, the ozone is also a fuel for chemistry. Like it's basically jet fuel, pouring it on all your stuff. We're talking about bleach and ammonia and all that stuff. And the tests that you would see people saying, oh, it creates very little ozone. They're testing it in the air. And ozone is very sticky. So it comes out and it immediately sticks to surfaces or reacts with something. So it disappears. So testing the air, if I'm correct, Delphine, please correct me if I'm wrong, is a silly measurement because even if you get a tiny bit in the air, it means there's a lot that was created and stuck to things immediately.
Yeah, we did an experiment in home chem where we had an empty, as in no people in it house, and we added ozone at high levels using one of these little commercial ozone generators. We sent it straight into the ventilation system. And so we measured the amount of ozone coming straight out of the generator, and we knew it was incredibly high. And then we were also measuring the ozone inside the house, and it rose, but it was actually quite low. And what that told us was that all of these ozone molecules were reacting on the surfaces inside the house. And there's damage you can do to your building and to electronics, rubber, anything that's plastic, doing that. But it also told me that if there was anyone living inside the house at the time, anyone breathing, then they would be exposed to very high levels. And so that was a real wake-up call. And as Corbett said, you're just fueling chemistry, and if there's one thing you should be doing inside your home, it's trying to reduce the amount of chemistry that you have, because chemistry is going to the actual chemical reactions occurring inside your home. That's how you can produce formaldehyde and isocyanic acid and all sorts of different molecules that all have different health problems. And the goal here, especially as we're spending all this time inside your home, is trying to make your home as healthy as possible, because that's the reason you're here. So there's trying to stop any coronaviruses from coming in, trying to kill any that are in your house, but there's also keeping you and your family healthy at the same time. And that means really reducing that chemistry.
Absolutely.
I asked Bob to bring up a slide briefly because we think that the challenge of, in fact, somebody went to Home Depot, one of our staff went to Home Depot and said that you couldn't buy a freezer, but the air purifiers, the portable generators, whatever, all those things where they clean air, were plenty of them on the shelf. People were not freaking out about that. We recommend just getting a box fan and a 3-inch MERV 13 filter and just taping them together. And you can buy multiples for the same price of another one. I know that contradicts a lot of manufacturers, but in general, the more filtration you can do, the better off you are. So you can get those devices. I have those devices, so I'm not saying don't buy something that is that. No, there's a slide that actually shows how to make your own box fan filtration system where you just get a 3-inch MERV filter. We recommend MERV 13.
Is that the slide you wanted, Joe?
Yes, 20 by 20.
You're killing me, man.
Tape them together. Well, that's what I put in there, the slide with that. So anyway. So there is it's a simple thing to do. Many of you have seen these things, and we think they're now a simple thing that you can I think you can still buy a box fan at any of the stores that sell them. They have not gone off the shelves until today. That's it. They're going to be gone. And you get your filter from Amazon or someplace similar.
Joe just started a buying panic
That's
of
right. Yeah,
box
right.
fans.
Yeah,
That's
another
one of the
one.
things I love about you is your props. You always have very interesting ways of putting things together to make a very effective model. So let me move us on for a second. So surface stuff, because this is one of the differences with this virus. First of all, the main difference between outdoor atmospheric chemistry and indoor atmospheric chemistry. Delphine, you please feel free to chime in on this once I get done with my little intro. The main difference is surface to volume ratio, right? So there's so many more surfaces inside of a home than there are outdoors, even in a forest. So when we're talking about a virus that can last much longer on surfaces than a normal virus can, and Dr. Sanborn, can you please tell us how long these things can last, how long the virus itself can last on a surface?
Yeah, this particular coronavirus is unusual in that it can last for days on surfaces after the initial respiratory droplet.
Up to like a week, right?
Probably up to a week, definitely days.
Okay, so
it diminishes over
now,
time. Yeah.
right. So if I can, I don't know who exactly would like to chime in on this, but particles. So like if you take dust, right? A dust particle, and if you look up into the sunlight streaming through your window, you can see little bits of dust floating along. Those are technically surfaces too. So I'm wondering, can a virus project from your mouth in a fine mist and then glom onto a piece of dust and then float around and not drop to the ground or drop, you know what I mean? Like, how does the, first of all, surface to volume ratio, and also the fact that we've got particles and dust kind of floating around inside the space, how do these impact what's going on?
So I can take the particle side, and that's the amount of time that a particle will remain suspended in air in the indoor environment really depends on its size. So the coronavirus itself, if it's not in any droplet, just bare virus, is 120 nanometers. So it's really, really small, and that should last something, it would last in the air inside a home, something on the order of half an hour. But most of when you cough, or even when you talk or breathe, you emit respiratory droplets, and those are larger, and they can contain viruses. They can contain different numbers. I think it's relatively poorly understood, and it's going to be very individual dependent how many viruses are in any given respiratory droplet. But then those can stay suspended in air for hours. And that's where ventilating your house, there are a lot of things you can do to control how long particles will remain in suspended. I think these box fans that Joe is talking about are with a filter attached are a great way to try and reduce the amount of time that those particles are going to be suspended in air. So that amount of time is going to depend on their size. The really, really big ones that you can see when someone's coughing with a lot of production, then those aren't going to go very far. They're going to settle on surfaces, and then that's what that's the surface source that Michelle's been talking about. But then those particles, if they last longer, they can get transported throughout the house, and we can see that when you cook, and you know this, when you cook in one room in your kitchen, and you can smell the bread baking, or you can see the burned smoke from the toast come into another bedroom. That should give you an intuitive sense as to how long and how far some of these particles can travel.
A couple of follow-up questions from the online audience. Speaking of a question about whole house ventilators, versus whole house air filtration. And then the follow-up to that was also using HEPA filtration in conjunction with either UVC or some other technology with that. How effective is that with dealing with COVID-19 as far as being aerosolized? But again, I'm understanding that that's not going to stay aerosolized all that long.
The studies that I found about aerosolation was about 10 to 30 minutes, but that was in a kind of a controlled environment. So the other question which was brought up about dust, and that is that depends on how active your house is. Most homes probably were active for a few hours in the evening. If you have younger kids, your home is a dust nightmare right now. So if you have a bunch of people, little kids running around, especially the kids are lower to the carpet, and the dust already is an issue. So there is this, if you have two seniors at home, there's probably not a lot of activity that's causing these issues. But in homes where you have the most impacted people are those who have younger kids who are home, jumping off the walls and jumping off the furniture. I know Corbett is in that situation, so maybe many others are. Yeah.
A couple of follow-ups there too is both from our chat and our Q&A. How does anybody have a handle on how long viruses would this virus we don't really know a lot about, but in general, a coronavirus, how long can it survive on a surface of, let's say, an air filter? And what happens when that droplet desiccates, dries out? Can that virus still stay viable when it's no longer on that suspended saliva droplet?
So there's a very recent paper that shows that the virus will remain viable. Also, to what extent that is and how infectious that is a very different question. But it does remain viable on cardboard for about 24 hours. And from a chemistry perspective, your HEPA filter and cardboard aren't so different. So I think that's one piece of information. I think HEPA filters are fantastic. And I know that a lot of hospitals use UV light to disinfect. It can be a very effective disinfectant. As a chemist, I am always a little worried with UV light because it, again, can do some really interesting and toxic chemistry. So, but there are enclosed systems, I know, for buildings that incorporate UV light and HEPA filtration. And I think if properly done, that's a really interesting idea.
I'll take the dangerous avenue of chiming in on UV. So the studies that we have found show that it has struggles to purify air as it moves over it because of the amount of time it has as an exposure.
Yep.
It does have a much greater effect when it actually is able to be used on a fan coil as long as the entire fan coil is covered, which means both sides, and doesn't have shadows created by the environment. So that's very effective from our perspective, but just having it run right by a fan, by the light in a matter of a fraction of a second. So we think a plenum needs to be around 10 to 20 feet long with a light that long to maybe consider to be fully effective. So if you're going to find the studies, don't find a study from a manufacturer. Try to find an independent study because everybody can create their own result in their own lab. So that's my caution to you about those kind of lights.
So just as a quick review for everybody who's watching, do not let your mom and dad buy an ozone generator. Don't let them mix chemicals. Don't let them rush out and buy a UV light for their HVAC system. Also, the filtration level that Joe was mentioning earlier, MERV 13, is not HEPA. HEPA is MERV 17 to 20. So if you want a HEPA system, that means you're gonna have to get a bigger surface area. If you were to jam a HEPA filter into your furnace, it would probably break the furnace. Yeah, so don't do that. So here's the slide that Joe was talking about with a nice wide media. You see that filter is 4 inches wide. Many of you do not have a filter slot that is 4 inches wide. Yours is 1 inch wide. So don't, this is not going to work on your furnace. But Joe's point is to increase the circulation. And I'd just like to make a point that we're going to talk more about later at 3 o'clock. The house that I'm building right now outside that window is a high performance house. It's modern and it's built to modern code. So it's more airtight, it's more insulated. Therefore, it's going to have a smaller HVAC system. And so it gets less circulation. So the amount, even if I had a HEPA filter, which I do, the amount of air inside the entire volume of my house that's going through that filter on an hourly basis is minuscule because it's just such an efficient place to live. So this is kind of one of the places where energy efficiency and home health are at odds with each other, and that's what Joe is trying to fix with this box fan.
Well, the other it only works when it's on for your furnace. So if your filtration, you're like, hey, I have a really great filter, and it only works when your system is running. Now, some systems are sophisticated to run regularly to do that, but don't think that you could just take your system and turn it to on and try to filter your house because you have no idea the impacts of infiltration as well as energy bills that could produce.
Right.
I think the one point that we kind of skirted over but we didn't really cover is that if people are going to be self-quarantining and staying in their home environments a lot longer than usual per week, per day, all the existing issues that we've been worried about with indoor air quality and problems with buildings and microbiological and, off-gassing for formaldehyde and a bunch of other things, are we not radically increasing our amount of exposure, with just longer time in there? And how do we deal with that? You throw it at Michelle.
I just like to add to that,
Oh.
which is that that part of an intro that I had written last night that Joe was like, that's a little negative, and you're right, is that I wasn't really convinced when we were just talking about death toll stuff. I was like, okay, people die all the time. That's a horrible way to think about it. But the thing that is interesting here is that what Bob just brought up is that kids get asthma and allergies symptoms from houses. And a lot of people know this. Joe would have a lot of data about this. But I would say that if we saturate all the hospital beds in the country with COVID cases, and people are stuck there for weeks having a machine breathe for them, then kids can't have allergies and asthma. We can't have babies. We can't have people getting cancer because now we've totally saturated the system. So that's kind of one of the issues here, is that we've got this health concern and we're solving it by putting people into another health risky situation in their homes. And again, I'm having nightmares thinking about some of the homes that I've tested over the years and seeing the crawl spaces of and things like that. So anybody else have anything to?
Well, the stats
So
are oh, go ahead. No, please go ahead,
yeah.
Joe.
No, I was just going to say that leads us to the slide, the flattening the curve slide. So if you think of coronavirus as a bad mutated cold that we do not have any immune system for because it's novel, then we will all get symptoms if we're exposed. Now, some of us get very mild symptoms and some of us get very severe symptoms. Some people don't even know they have it, and so they're more likely to spread it. So that's why, if you look at the slide, flattening the curve, it shows why we're all here hibernating in our houses. Is because if everybody gets it all at once, if 95% of the population gets it all at once, we don't have the capabilities to handle it, and we're going to crash. But if you can, some people can get it over here instead of over here, then we'll be better equipped to handle it, and we can handle the allergies and the asthma on top of the coronavirus.
And as Delphine mentioned earlier, you emit these droplets not just when you cough and sneeze. If you are talking or breathing, you are emitting droplets that can stay in the air for what you just said was an hour or two, right?
Yeah.
So do not let your parents go to, I think that all of us are having these conversations with our parents, trying to get them to stay home and not go out, which is the funny reversal of when we were teenagers. So can we talk for a second about humidity? What's the existing evidence about the relative humidity and viruses? If we keep the house dry, which is one of the things that I listed at the very top, is that going to help with the virus transmission?
So there's some research. It seems there's not a lot out there on coronavirus, but there is a little bit that suggests you can reduce the movement throughout a room using higher humidity.
Higher humidity.
Yes.
Higher humidity.
Yes.
And so, but we're not talking about damp houses or damp buildings. So don't go flood your basement. But for many reasons. But there is some emerging research that suggests that higher humidity is going to reduce how far these the respiratory droplets, etc., can transmit. That said, how much humidity, how far are we talking about stopping it? We don't have the research out there about that yet.
I have a slide that answers this question for us, because I found 2 research papers that actually show this concept that they did studies in the hospitals of 370 some patients with 8 million data points to confirm that when humidity was low, the virus had this wasn't this virus, it was the flu virus, and similar viruses had a high rate of transmission. And so then they increased it to at least above 40, and they reduced the conditions. And they explain in the paper, Bob has a slide, I'll put the link here in the chat in a minute, that it was actually when your skin is dry that you have more flakiness and more things that actually become more airborne, and that the virus has the ability to transmit more because you are actually releasing this kind of condition, that you have higher humidity, that your body did not do that as much, as well as it was more receptive to combat those kind of conditions. So there was 2 research conditions that I found last night that were changed my view about relative humidity. I was like, holy cow, it's one thing for us to all talk about it. I've always been concerned about the top half, above 60, 65, but I was now convinced that below 70 is actually a potential issue in your homes.
Joe, this is a slide you wanted up? Graph?
No, that's actually the one. This actually refers to briefly what you talked about staying home. You can see where Japan is. They actually caught it on quicker, but Singapore and Hong Kong, within the first week, did what you may do in other extreme circumstances where you say, oh, they're having issues, that area is quarantined immediately, and they shut down schools, shut down everything in isolated areas that prevented the spread of the coronavirus in Singapore and Hong Kong. You can see that they were super active in testing and restricting people's movements within, 10 days of the days since 100 cases showed up. Most everybody else did not get that, and we are on the other curve to follow everybody else.
You're looking at that one right
yeah,
there.
That's
okay.
it. Yeah, thanks. So, no, that's ventilation. There's another one on humidity.
But I do want to
Yeah,
jump in, and
right.
maybe Michelle, you can also add your 2 cents here. I think that there is some research about flu and cold viruses, but the coronavirus that we're talking about right now, it's a slightly different beast, and it may behave a bit differently from some of these other ones. So my understanding is that while we can use some guidance out of flu and cold research, it's still a little open and uncertain as to how relevant that's going to be. Michelle, maybe you can add to that.
I agree. One thing we do know possibly is that it doesn't like heat, which is kind of funny. So one of the questions is, oh, is it going to go away when the summer months come? We don't know. We just, it's a wait and see on that one.
That's why everybody's at the beach in Florida.
There you go.
So I'd like to just distinguish real quick, because microbes seem to in turns freak people out, and also engender this feeling of, like Delphine and Nina at Home Chem taught us, that we are not individuals, we are a planet, and I have bugs living inside me and on my skin, and they're everywhere. So I'm really like a collection of bugs and individual little pieces. So microbes are going to be one of the victims of this disinfectant thing that we're doing, right? We're going to basically like wipe out all the ecosystems on the surfaces around us that we're trying to disinfect, which is the same thing as taking a bunch of antibiotics. And then when you're done with that, we're going to have to eat yogurt and eat probiotics and try and get that healthy thing going back on. So I'd like to maybe, so first of all, Michelle, can you talk a little bit about the difference between a virus and a bacteria or a microbe in the classical sense?
Well, throw fungi in there too. Throw fungi in as well.
Sure.
Because that's the harder one to kill.
We'll start with the whole
and then Delphine, if you could kind of take that ball and run with it on the kind of how the recolonization works when we're done with this period. So take it away, Dr. Sanborn.
So viruses tend to be, this is off the cuff, so viruses tend to be, I believe, smaller than bacteria. We tend to fight, we fight it with a different part of our immune system. So if you think, oh, I'll take antibiotics for this, it's not going to work because it's not bacteria. Antibiotics are for bacteria. Antivirals are for, our viruses, like the influenza virus. We don't have that many viral medications right now, especially this. They're working on it. Okay, and then as far as, clinical symptoms, you're going to have more long-term effects with the bacteria. The viruses tend to be short-lived. Now, if you start out with a virus, and then you can get bacterial superinfection. So you start out with a coronavirus, and then you get a pneumonia with a different bacteria. That can happen, and we see that in our, most severe patients with this.
Yeah, and I'm gonna add in a few things we learned in home chem about microbes in general. And so, as we're learning, there are viruses, there are bacteria, there are fungi. So that's your mold with spores. They all have different health effects. They all need to be dealt with in very different ways. From a chemistry perspective, something that we learned is that if you mop your floors with bleach, according manufacturer instructions, clear out as much of the microbes as you think, you will still have some component of a resilient population left, and they're not necessarily dangerous. They're not necessarily bad. We don't know, but you are still going to have, it's hard to actually kill everything inside your home. So your home is filled with different microbes. Again, not necessarily bad, but they are there in our built environment. So our home is living as well as, and so yes, you're going to end up clearing off some of those microbes. Some will stay. In terms of what's going on in your house, I don't think there are negative health effects to killing off the microbes. I think in terms of your own body, there's established literature that says that's an issue. And so very clearly, you want to use the right tool for the right job. And if you're dealing with viruses, you want to use the appropriate antivirals. But from a cleaning your house and surface perspective, then those are all the, it's the over 60% alcohol, the bleach according to manufacturers, directions, soapy water. Those are all good ways to do it, as long as they're done separately. But I wouldn't worry about killing off the microbes in the house. But I think it's something that we're going to have to see what happens when people when they get better with this virus and what happens to their microbial populations. But I don't think that's top of my priority list right now to be concerned about. We'll see down the road.
Let everybody know, we'll run a little long to cover these questions. So I know some of you, trying to get questions in there. We're trying to cover them, but not totally disrupt our flow as much as possible. So we'll stay online a little bit past that 12 noon mark and try to cover these all for you.
It will be interesting to see what happens, because if you look at history medically, when we took away parasites, we don't usually have worms in the United States, but they have worms overseas. When we took that away, some of our allergies got worse. So yeah, maybe our allergies will get worse.
Many of you may be familiar with Rob Dunn's book, Never Home Alone, which, don't look at the cover, it's not about bugs and stuff in your house. It's about that we've been changing our environment slowly to try to make it sterile. And as you pointed out, once you do that, then you only allow something else that's worse to then come in and take its place. You now said, oh, hey, you're free to now roam and actually take over. And some of those things we now don't understand how to combat or actually how to get back to a normal ecology. So we are not helping ourselves with our sterile mentality that we have right now.
Absolutely. So we've got 10 minutes left in the original schedule. And like Bob said, we'll go long so we can answer some of these questions. Some of these questions have been answered already in the session. But I'm kind of like scrolling through here. And I just wanted to, let's just start listing some of them. So it's interesting. Would you comment on the use of plants inside the house to help? Any specific ones that can help against viruses?
Nope. They're not an effective. They're not an effective way to clean your hair. You're definitely not to clean your hair. They're not an effective way to clean your air, and nor are they an effective way to deal with viruses. That said, there isn't much negative downside from them as long as they're not toxic to you or your pet. So go to town with your indoor garden, but it's not going to help you with the viruses.
Mm-hmm. Caleb is asking, a lot of biologists agree, a lot, and he says, not all, that viruses aren't living organisms. And that definition of living is debatable. They are more like androids, created fully formed and rely on actual living organisms to replicate and sustain. That means that they lack the machinery to recreate themselves, so they have to hook onto something else. But in this way, they're kind of like sperm, right, Michelle?
Well, they are somewhat symbiotic. They have to have an organism to be living on. That said, we know that they can live, at least this one can live on surfaces, as we said, up to days by itself without another organism. But eventually it will have to cling on to something to prolong its life. Otherwise it will just die out.
So it is a little different than a microbe. but I think that we fight probably the same way in spaces, right? Not with antibiotics or antivirals, but the disinfectants that you were talking about, Delphine, will work on both, right?
Yeah, yeah. The home approach to dealing with them is going to be the same as if you were dealing with bacteria. And I think to an extent with mold, although of course we have this humidity shift where I think with mold, you're always trying to dry the house. And here we're talking about maybe some elevated humidity being a good idea. But yet the way we fight viruses is going to be very similar to the way we fight bacteria.
Follow up to that
Outside
too.
the home, not in your body, obviously.
You know, with that humidity increase, though, you know, proposing that, and Bill Turner had a question or a comment on that from Turner Sciences up in Portland, Maine. That, you know, if we start increasing most of these homes are not, that we currently live in, especially in the north, are not really designed to elevate the humidity, especially during this time of year or even any time of year. So, you know, I think we have to be cautious. I know that this is like, it's the lesser of two evils, but if if we raise the moisture levels in the house to try to make it less hospitable to the virus, we could create, you know, a whole host of other fungal related problems in the space. Dust mites are going to increase. Everything's going to increase when we do that.
Yeah, and there's an interesting issue that, I mean, as I say, the research isn't really clear about how far the transmission is going to stop. So, I mean, I think one cautious approach is to think that if someone is actually ill inside your home, then the room that they have hopefully quarantined themselves in, that would be a great place for a small portable humidifier. But I think that's a fantastic point, that you have to work with the house that you have, and the knock-on effects of high humidity, I think we should be very, very cautious of. As I say, the research on coronavirus and environmental conditions, it's still in its infancy. You know, normally we spend we've known about flu for many decades, and Michelle can comment on all of the research that we've done with that. This is a novel virus, and that means there just isn't a large research base to work from.
Somebody, Michael is asking, what about a sauna? Should I go to the sauna every day? Will it kill everything on our skin?
Some people would believe so. Some people would argue for that.
Probably Scandinavians.
Definitely.
That's right.
Everything is about the sauna.
Well, I mean, but isn't there truth that anything that would, you know, there are health benefits with sauna, right? So, you know, it's part of this being able to defend yourself against exposure, right, is to actually have yourself in top health. Is that correct?
Absolutely.
And you know what, one of the things that there's been some very established research on is that lower stress levels mean a healthier person. And so if going to the sauna reduces your stress levels, go for it. I think it's not going to kill everything on your skin by any stretch of the imagination, but I don't think there is there's any harm in continuing a normal and healthy practice of sauna. If I had one in my house, I'd probably take advantage of it on occasion.
I'd like to talk about ventilation before we
finding one that's
go ahead.
open. I was just saying the trick is to find a public one that's actually open.
Yeah. And then maintaining 6 feet and not touching any surfaces.
Exactly.
Yeah, I think private ones would be the way to go.
I've been too close to the panel all day. I apologize.
It's your panel, though. You're separated by 2,000 miles.
Started a private sauna buying boom, so now we've got 2 economy splashes that we've made.
There you go.
What were you going to say, Joe, about ventilation?
Yeah, I think that I have a slide about it, that there are other studies that show that increased ventilation can also be a incredibly preventative measure. Again, not necessarily against coronavirus. We don't know a lot about that, but in general about flus and other things they've studied. So I have a slide that shows that. I already posted the link in there already. So they actually made the dramatic statement that it could be almost somewhat effective as the preventative measures from, giving everybody their flu shot. They felt that it had a 50% equivalent to that. So, there's the access is there. I put the link already in our chat window, and you can have access to that. So anyway, this was kind of opened my eyes last night about how ventilation can. And now ventilation is a variety of opportunities. Just opening your windows on opposite sides of the house can do that. It can also impact your humidity levels depending on temperatures. There's, everything has, house is a system. Everything impacts something else. But we believe one of the foundations of a good house is that it has really good independent balanced ventilation. So I think it's one of the post things that's going to happen out of this is people are going to reevaluate their home and what measures they can do to make it more safe or preventative for some of these conditions.
One thing we didn't cover at all, it was no mention of, and this one is near and dear to me because I've made a paradigm shift in the last several days. The Surgeon General came out and dissuaded people from wearing surgical masks in the general public because they're not designed to actually protect you from inhaling things. So, if you were going to wear a mask, it would be an N95 mask or even a P100, like a HEPA type mask, would protect the individual. But I think the one paradigm shift that I had is, wait a second, if we're really trying to limit exposure, is there not a benefit though to the general public, especially ones that may be contaminated, may be affected and have the virus, not know it, to wear a surgical mask as they're doing in Asia, because it is limiting your ability to spew things out, into somebody else's breathing zone. Thoughts?
I would agree that if you are sick and you are going out in public, it can't hurt to wear the mask. And also it protects you from other things.
That said though, right, I think one of the concerns is that, I think it's a fantastic thing for people. It's going to stop those respiratory droplets from coming out. So if you have it or you possibly, have this virus, that's a great way to prevent, to reduce the spread. That said, these surgical masks are not, they're not fitted. They don't cover your face. And so we have a lot of outdoor air pollution research actually that shows how masks work in terms of stopping small particles, i.e. the size of these droplets and these viruses, from getting in. And so from those perspectives, you have to have a fitted at least N95 mask. And so these surgical masks aren't fitted. So as you're breathing, if you're in the presence of other people, those small particles are going to be able to come in through the sides of the mask very effectively. And so I think one of the concerns about people wearing surgical masks to prevent themselves from acquiring this virus is it's going to give people a false sense of security. And they're going to feel like they're invincible and you can go out into public and you've got your mask on. And that's just not true, because these viral particles, these respiratory droplets, they can absolutely move into these masks. And so it's really there to stop people from spreading the disease if you think you're infected. But it's not a great approach for stopping people, for stopping you from acquiring the virus. And I think one thing that's very clear right now is that a lot of our medical systems do not have enough PPE. So I would say that anybody who has large amounts of these masks, they're not going to stop you from getting infected. So unless you or a family member is sick and is trying to not share that disease, then these need to go to the folks who really do need to use them in combination with other forms of protective equipment.
But I do think that ends up focusing on that point is that wearing the surgical type mask isn't going to protect you. I think we all agree on that. But perhaps there is a social responsibility that you're going to limit your potential to distribute contaminant out of your body to others. It's not going to protect you, but it's, and I know it's kind of un-American. We're always, we don't tend to worry about others as much as we should maybe. But I think there's a lot of value in that. And I think it's just really important that general consumers understand the difference, right? The surgical mask is limiting you from contaminating others. The fitted mask is protecting you from breathing in others' contaminants. So there's two ways of looking at it. And since we really don't have a lot of testing out there yet, as far as we don't really have a good number in the populace, do we, Michelle? As far as,
we do not.
There's got to be like 100-fold or more actually people
sure.
carrying it.
We are seeing the tip of the iceberg. Just imagine if you have a cough and shortness of breath, maybe a fever, maybe not. You just assume you have a coronavirus. You are guilty until proven innocent.
Yeah. And
okay, I'm going to be
masks come in. Is right there. You think you might have a cold. you start wearing those masks. That's it.
Wait, I'm not afraid to wear the mask. There's a strange thing about when I travel a lot, and Americans are like, I don't need no freaking mask. You know, you're weird for wearing a mask. I wear
Oh,
my
that's the
mask
first
through the
F-bomb
entire
in this
airport.
entire webinar, Joe. Your first
I wear
webinar,
my
you
mask
dropped-
once I get in the airport. My mask is on, and I don't care what people think, or because I'm like, it doesn't matter. I mean, like, you know, it's I dress casually and I put on a mask, and I think that it doesn't hurt to feel that it's okay to do those things. So I'm not wiping down, you know, silly
just
things
have
as
to
I go
know.
through the airport. But I promote that, you know, wearing a mask doesn't hurt anybody, and it only protects you. N95 is obviously the best way to go. A breathing apparatus on the mask is actually even better. So, you know, if more people were wearing masks a long time ago, I think we could have prevented some of the exposures.
Just so you
Okay.
know, though, as Delphine mentioned, you have to have it fitted, and you can't have hair, you can't have things in the way. It's very hard to get that seal.
Yeah,
So some people have to shave.
Anything is better than
Well,
right.
but I think you've got to be careful with that. I think it's the exactly. I think what Bob's got, he's going to be good to go.
Well, again, this for professionals that are dealing, and we're dealing with environmental exposures, asbestos, mold, all that stuff. You know, that's a full fitted HEPA mask is really, that's
We
going to
promote
give you some
N95.
protection.
We promote N95 masks, and
I agree.
we describe fitting it to your face, right? But I'm not going to shave.
Moderator is going to step in as the sergeant at arms, and I'm going to say, first of all, thank you to the 162 participants that we've had in this thing. We have 24 questions stacked up in the Q&A panel. We've got chat stuff going on. There is no way that we're going to take this long enough to answer all the questions that keep coming up. So I'm going to say everybody should tune back in at 1 o'clock and then at 3 o'clock, where we're going to take these questions and we're going to shuttle them over to the next session. I'd like to end on this sense of false security, which is what we are all talking about today. In this, staying home is making us feel safe. And of course, lesser of two evils is what we're really talking about here. It is important that you sequester yourself, that you quarantine yourself, because the government has the constitutional right to quarantine us by law and put us in prison or fine us if we don't. Don't let them do that. Let's all just be nice about it and do it yourself. Thank you very much to Michelle, Joe, Delphine, and Bob for being here and lending your expertise. We will pick this back up at 1 o'clock. Thank you guys very much.